It's one of the most polarizing and frequently asked questions that I see from doctors. Should I make some extra money on the side by becoming a supervising physician? We'll discuss that and more on this episode of Bootstrap MD. Should you become a supervising physician? Here are 4 questions you need to ask yourself before proceeding. My name is Dr. Mike Wu Ming. I'm the founder of Paradise Practice, which is a consultancy firm that helps physicians own their own cash-based medical practice, as well as I'm the owner of Bootstrap MD, which provides career coaching for physician entrepreneurs and medical entrepreneurs. I'm also the author of the book, The Positioned Physician, Earn More, Work Smart, and Love Medicine. Again, the doctor's playbook for entrepreneurship. And at the end of this video, I'll show you a link where you can get access to this book delivered to you for free with a small shipping and handling charge. Okay, with that promo out of the way, I want to cover one of the most polarizing questions that you can see on a physician forum. And usually the circumstances is this. You'll get a post that says, hey, I was in a medical spa, or I had a friend who owned a medical spa, and they asked me to become a supervising physician. They offered me $1,000 a month. Should I do it? And then usually what happens is a barrage of negative posts on why you shouldn't do this. Everything, and you'll see posts like, do you want to throw away your medical license? Are you renting out your license? Get ready to be targeted by the medical board. Get ready to be, put in handcuffs and be on the evening news and being thrown in jail. Okay? So the short answer is, do you want to become a supervising physician in my opinion, is no. But under the right circumstances, it could be an ideal path for you, especially if you want to pursue ownership into this area. So that's why I want to cover these 4 simple questions that you need to ask yourself before you actually want to do this. So the first question I would ask myself is, do I have interest in this area? And this is probably the biggest one. If you say no to this, then you shouldn't be doing it. If you get asked to be a supervising physician in a med spa, the first question I ask is, do you have interest in this? Do you want to do Botox? Are you interested in fillers? Are you interested in skin care? If the answer is no, you don't need to ask yourself any other questions. But if you are interested in this and it's something that you may want to pursue on your own, like opening up your own clinic, then there are some other questions you need to ask yourself. This might be the right path for you. So let me talk about my circumstance. So several years ago, I'd been out of medicine. I'd started a software company, did pretty well. We sold it, I was able to retire, but I always wanted to go back into practice again. In my case, I wanted to open a cash-based medical practice. And one of the areas that I was interested in is weight loss. It's something that I struggled with for the majority of my life. I had a friend who was not a physician, but a good friend who owned a series of weight loss clinics in Texas, and she was doing really, really well with it. And again, she's not a physician. And she'd always say, this is something that you need to do. It's completely cash-based. And I said, well, I'm not really sure. And I'm not sure what the exact circumstances were, but I did end up connecting with someone who, again, a non-physician in my area, not directly near, but a few miles away, wanted to start a weight loss clinic. They had already became a manager of a weight loss clinic. They knew what they were wanting to do. They had their business acumen. And over the period of a year, we kind of wooed me, no pun intended, about becoming this. They want to do things the right way. I really enjoyed speaking with them. And for myself, I was very open to it. Say, hey, I'm interested in this because I'm thinking about doing this on my own. And we were really cool. We were far away. There wouldn't be no competition, and everything was fine. And I still work with them this day. It's been incredible, great opportunity to. It's been a great relationship with, and I've helped grow my clinic based upon what I learned, and I've helped grow their clinic as well. Because when we get together, we discuss marketing, we discuss marketing practices, we discuss online marketing, offline marketing using coupons and different avenues, and see which one works. And both of our clinics have grown because of it. But the reason why it worked is because I was personally interested in it. So I joined up with the Obesity Medical Association. I keep on touch with what's the latest going on in weight loss. I know I belong to different forums. It's something that I have personal interest in doing it. So that's the first thing. If you have no interest in med spa, do not go ahead and become a supervising physician in that area. Number two is, what is my risk tolerance? And that comes down to is, what is your experience? What is your knowledge? In my case, my risk tolerance, in most businesses, becoming a supervising physician, there is considerable risk that you need to do. Weight loss, in comparison to med spas, is a lot lower risk. Yeah, there are some things that you need to be aware of in terms of scheduled medications in my case, but you may be in a situation where you're not doing medications at all. But then you might be going to something like a med spa where, again, there's various degrees of your risk. It could be just simple facials, maybe some PRP, or they could be doing full-on fillers where there's a chance for an occlusion, lawsuits. Again, a considerable amount of risk, and you feel uncomfortable with that, do not go into that direction. And again, that's based upon your knowledge and your own experiences. And if your answer is, I don't have a very high risk tolerance, I don't have a lot of knowledge or experience in this area, boom, do not become a supervising physician. Number three, are you willing to do what it takes for the success of that business? Meaning, as a supervising physician, you should be comfortable being trained in every procedure that they're doing. You should be comfortable in seeing patients that are coming through. You need to be able to sometimes, if something happens, be willing to drive there and make sure that the patients, everything is being stable, if you ever been asked to do it. Most people think, well, become a supervising physician, get paid $1,000 a month, I'm great, I don't have to worry. No, you never know. As someone who is actually, first of all, medical boards never really like that situation where the physician is in another area and doing it, but they also need to be, everything that is going on, from writing up all of the protocol that's being involved, what's coming through, how to handle the medications, that all you need to be 100% aware of what's going on at all times. And so when I see, med spas offering like $1,000 a month and then finding physicians actually take that is like, oh my God, do you know what's involved becoming that? You are just renting your license and you are just ready for a disaster. But again, you need to be going in and jumping in at a moment's notice. And then the fourth question that you need to ask yourself is, do I trust the people that I want to work with? And for example, in my circumstances, we've got a great relationship. We're growing this. We're here in it for the long haul. And it sounds like a marriage because it is a marriage. If the people that you're going to work with, it's really a kind of a gut feeling, do they have the patient's wellness foremost in their mind? Is this something where they're doing it because they have a mission, they believe in it, and this is what they do? Or is this someone's like, hey, you know what? I see a great opportunity to make a quick buck. Let's add more procedures. Let's cut corners. That's when you need to run far away from that. You want to make sure that they have the patience over profits. And again, that's very hard in this day and age. That's hard to find. So those are the four questions that you need to ask yourself. Number one, do you have interest in this so much so that you want to own your own practice? Number two, do I have a high enough risk tolerance to take this on? Number three, am I willing to do what it takes for the success of the business, even if it involves seeing patients and being trained in all the different procedures and researching everything that needs to happen and answering, if knock on wood, hoping never happens, you're going to be the one responsible for an audit if something in there breaks down. And number four, do I trust the people that I'm going to be work with? Those are the questions you need to ask yourself. So because of those questions, there are very few circumstances where that occurs. But if you're able to find a situation where it really is a win-win situation, this is something that you want to do, you want to grow, it could be something that really leads to a path to entrepreneurship where you can actually get paid and learn at the same time. So thanks for watching. Again, if you would like to pick up a copy of my book, The Positioned Physician, I want to send it to you for free with a little bit of shipping and handling charge. The link you want to go to is Positioned Physician. That's positioned, ed, physician.com/free book. And I'll be happy to send that to you right away. It discusses my journey to a 7-figure business and then starting up my own cash-based practice. I detail it all in the book, how this occurs and how this happened. This is Dr. Mike Ming from The Positioned Physician, owner and Paradise Practice and Bootstrap MD. As always, guys, keep moving forward.